All right, so let's get started today, and we're going to start a series on an integrated and holistic approach to relieving low back pain. Now, if you haven't seen my introductory video, you can find that on my YouTube channel or my Rumble channel. I'll have links in this video for that, but I'm going to do a little bit of an intro so that I can preface the first part of this series with a little bit of background. Now, most of you know who I am, you know my background. So, what qualifies me to give such a presentation? I have come to understand in my over 35 plus years in the industry in working with people with all kinds of orthopedic issues. Now, I want to say that when I refer that I've been working with people, that means I've been working in concert with someone else. And the bulk of this observation was really seen and observed between 2003 and 2022, specifically 2003 and 2008, when I worked for a chiropractor who was also a functional neurologist and a functional nutritionist. I was the director of corrective exercise at that time, and I also assisted him in doing orthopedic evaluations. With that being said, I took the bulk of what I had as a background before I moved to North Carolina to work with him and work for him. And I continued my education at the Czech Institute. And this is what is presented. What I have here is what I did while living in North Carolina and working at Advanced Chiropractic Center. I'm not doing this to boast about my background, but I have to let people know what qualifies me to present on such a topic that's pretty serious. And what I seen in between 2003 and 2022 was pretty amazing. We got a lot of results, of course, but the statistics for low back pain kept going up. And what prompted me to go back to school in 2003 and to relocate was that I kept seeing more and more orthopedic issues while working in Wisconsin between 1990 and 2003 when I moved. And these statistics kept going up, and it just didn't make any sense. And I'll get to all this. But this is what gives me the background. And working with this chiropractic neurologist, I'll call him, and my studies are very in depth. We take a scientific approach to low back pain, scientific approach to core training, stretching, and nutrition, and so on and so forth. So that offered me an inside look at spinal conditions. We are trained at the Czech Institute to identify spinal conditions, and then when in doubt, we refer out. So I was lucky enough that when I was working in clinical, those patients came through the door, and then together he and I worked together, got a lot of success. And when I opened up my own facility in 2009, I kept referring to them because then I was getting my own clients, but they were all having orthopedic issues. Even though the topic is relieving lower back pain, this can be any joint problem. It could refer to anything. Could be knee pain, could be shoulder pain. But I'm focusing on the back because that's the majority of what I've seen elevate between 1990 and 2022. It never really descended. More and more people, and this perplexed me. I didn't understand why we weren't making any progress. And one of the things that I discovered is that you don't have a back problem, you have a body problem. So in 2009, when I would consult with people, and now when I consult with people and they come to me and they say I have a knee or back or neck problem, I say, well, What you're going to learn today is that you have a body problem, and that when I look at the body, I look at the body as a whole and not the sum of its parts. So today, what we're going to learn is first we got to establish a timeline. We want to establish what happened. So we're going to look at some statistics and some facts, and then what I feel was missing, and then not only what I felt was missing, but when I applied these methods, systems, concepts, people got better. It's all about treating the cause and not the symptom. If you're here looking for symptomatic relief only, this presentation isn't for you. Because not only am I going to relieve the symptoms, because that is first and foremost was our job at the clinic, and even when I worked privately. But privately, what I began to teach people was if you really want to get rid of this, then we need to get to the cause of it, which is what I had to do because I had lower back pain that was unresolved. So this is what the learning objectives are going to be for today. And there's more to come, but we're going to start with this. So right off the bat, experts estimate that as many as 80% of the population will experience a back problem at some time in their lives. Now, I'll have links if you're interested. I'll have links for these references in this video. Current treatments for low back pain lasting longer than a year are expensive with questionable efficacy and safety. Now, this is something I witnessed. We had a lot of people that went through back pain surgery. My father did, and it didn't do any good. Now, I'm not going to say that it doesn't do any good altogether, because sometimes, you got to intervene. You have to use surgery, and I'm not, I had a lot of contacts that were orthopedic surgeons, both in Milwaukee, and I had a couple of them in North Carolina. But what I'm saying is overall, my clients didn't want to have surgery. And if they did, and if it did fail, they were in to see us clinically and privately. But number one, someone would come to me and they're saying, I'm trying to avoid surgery. The orthopedic is suggesting that I might have to have a lapidectomy or I might have to have some sort of a surgery. And Brian, I'd like to avoid that. And again, if I'm working privately, then I would call Dr. Wallachy and we would team up, or I would refer them out altogether. But tough cases was what I was used to working with. 8 in 10 Americans will experience back pain in their lives. So let me ask you, do you or someone you know currently have unresolved low back pain? 619 million people around the world are affected by back pain. 5% of people struggling with back pain will go on to develop chronic back pain. Did you know that there is an estimate of 76%? Let me show you something here. This is what we learn in school. 76% asymptomatic already have a disc challenge, meaning they don't have pain, but what they did in the study is they evaluated two groups of people and they found that 76% substantially higher prevalence to a disc herniation. So it's like the straw that breaks the camel's back. Someone comes to me and said, all I did was pick up my shoe or pick up my child, and that threw out my back, and I have to explain to them and say, well, that challenge that you had, that was just the straw that broke the camel's back. But that challenge has been there. And I would always discover where it came from in their health history, because the mystery is in the history. Because they come to me and they say, I actually had a client say this to me. I don't get it, Brian. I was picking up my shoe. How can the weight of my shoe throw out my back? And I had to explain to him. I said, that back injury was there. And we uncovered it. He told me, yeah, I was in car accidents 10 years ago. I had cervical problems 15 years ago. And temporarily relieved, of course, but something went undetected. And you know how it goes. If something goes undetected long enough, it's going to turn into a problem. So that's a little extra added information for you. 76 asymptomatics, 96% symptomatic, meaning that if I have a client that comes to me and they are in pain and they got pain running down their leg. I had sciatica and a bulging disc. That we got a problem. So $635 billion. So then I asked my clients, how long have you had this? And I'm telling you, you wouldn't be surprised when I tell you that some of them said 3 years, some of them said up to 10 years. And I had one person say on and off, various pain. This was a hip and a knee pain, which was actually a back problem, but almost 20 years. Then we look at the costs. So I asked them, I said, well, how many different practitioners and what did you try? And they'll say, well, I went to an orthopedic, I got prescription for physical therapy, I've tried acupuncture, I went to yoga. This is a variety of answers. Or some of them had 4 or 5 different people that they had tried to see. I tried exercise, hired trainers, I tried Pilates. Now, I mentioned this not to say that there's anything against what they're doing, because a lot of these clients, they got relief. Some of them got no relief, but majority of them got some relief. But you look at how much time that they spent over a 3 year, 10 year, or 15-year period that they invested, and whether their insurance company pays for it or not. If you have a premium, so you're still paying for it, and you have a copay, but then you don't get results. And then some of these practitioners are out of pocket. So some of my clients were saying, I dropped $2,500 on my back already, or I dropped, and I'm not kidding you, I dropped $30,000. Wow. You really start to get your head wrapped around, and you start seeing why it's costing us so much money. And not even to say, we're not talking about work related, it's costing a lot of money in the occupational insurance industry. So, you got to scratch your head. But the stats kept going up. I mean, these are the latest statistics, right? And I've been doing talks on this topic on and off for 25 plus years. And I always have to update my PowerPoint. So I go in, do some research, and lo and behold, it's not getting any better. So that doesn't make any sense, right? Low back pain is the single leading cause of disability worldwide. One half of all working Americans admit to having back pain symptoms each year. Americans spend at least $50 billion a year now annually, and across the board, it was, what was it before? 635 billion. Either way, it's too much. And that's just for the more easily identifiable costs. And we don't have surgeries and other incidentals worked into that. Now get this. Approximately 90% of lower back pain cases are considered non-specific or idiopathic, meaning the cause of the pain cannot be confidently attributed to a specific underlying spinal condition or tissue damage. They can't figure it out. And those are the cases that I would get 90% of the time. And thank God I had a team. Now, I had quite a team in Asheville. I had an even bigger team in Milwaukee because my education was less, so I had to have more experts. But in Asheville, I had the chiropractic neurologist, acupuncture, various types of body work, behavioral science. So if I had people that had, emotional issues, there were a couple physical therapists that were open-minded, and sometimes, I got to refer out to a physical therapist for specific therapy. But the point is, they're coming to me, the client's coming to me and says, I've been to all these different people, and nobody can seem to figure me out. So what specifically is going on? And what you're going to learn in this presentation is we're going to go down a road less traveled, because we're not looking at the other specificities involved. We're just looking at what's right in front of us. So I got low back pain. So we treat the tissue, or we treat the joint. But yeah, that's part of it. There's more than two spokes on a wheel. I mean, the hub has to be in good shape. The spokes have to be balanced in order for the wheel to run true. So what I'm getting at is the whole is greater than the sum. You can't just work on parts. That doesn't work. It's proven that over the last 2, 3 decades, when I worked as a physical therapist assistant, and I can't even really use the clinic I worked at because they were really kind of going down the road less traveled. But my point is, when I worked as an assistant, we mainly worked on the joint that was the problem. So where the pain is. And that's not where the problem is. The pain is your teacher, actually. But I digress. Although in our clinic we did have acupuncture, we did have body work, and we had a little bit more of a complementary approach. But my point is this: you treat, the symptom, and that's it. So you get better, right? You get a little ultrasound, you get ice, you get electrical stim, you do the soft tissue work. Maybe you're seeing an osteopath or a chiropractor. You get the joint manipulations, subluxations are corrected, and what you're going to learn is that the whole thing about tissue and putting joints back in alignment is all you're doing is you're removing nerve interference. You're rebalancing out the electrical system of your body. But my point is short term. So even when I work clinically and our patients got better back in the 90s, rather, not when I was working in North Carolina, our patients got better, but they came back. And I was working as a personal trainer privately, and then I would work part-time at the clinic, and then I was going to school full-time. But the point is, where I was doing my subcontracting at one of the largest athletic clubs in Milwaukee, we had a racquetball player, for instance. I seen him in the clinic, and I knew him. And I did physical therapy with him. I mean, the physical therapist did what she did, and then she'd hand him off to me, and I'd have him for 15 minutes. And then I'd see him at the club, and the physical therapist said, he gets released next week, Brian. He's met his standard for insurance, and he was about 75, 80% recovered. And there's still some stuff on the table, but they can't do it all. They only have so much time, and insurance companies only cover so much. And she said to me, why don't you pick him up as a client and work with him at the club, and I'll kind of let you know where I left off. And that was perfect. And that's where I started to grow my prehab, my post-rehabilitation, I should say, exercise system. That's where everything got started, was with that idea. And then it morphed into what I have today as a full-blown corrective therapeutic exercise system. So I could pick up where she left off. And then we were going beyond just working on the joint. But in a traditional sense, what we got out there is they work on your back, it gets better, and then you go into life and you got multiple directions you're turning in, you're turning, you're twisting, you're lunging, you're pushing, you're pulling. These are primal patterns. And if you don't restore the pattern in the body structure, so if I reach, how many different muscles am I using to reach with, right? A number of them. My back, my arm, right? My lower back, my feet, because if I have to reach. And that's a system. That's a movement system, has to be restored. And that does a lot better than just isolating one specific muscle. So I started learning more about that when I moved to North Carolina, but I was dabbling in that in Milwaukee. But what I'm getting at, I kind of got off track here, is non-specific. And it goes way beyond that. So my eyes really opened up after I moved to North Carolina. So again, do you know anybody that has non-specific, or maybe you do, they can't figure you out? All right, so despite all the advancements in technology, education, orthopedic, and primary care medicine, physical therapy, and corrective exercise, why are we still seeing a continuous rise in lower back pain and injuries? According to the Journal of American Medical Association, there has been little improvement in health status, functional ability, workability, or social functioning of patients suffering from spinal disorders. What's missing? So what's missing here? So you have to scratch your head. We got all this technology. We've always had it. We got even more now. We have a ton of education, everything from orthopedic to primary care. We have advancements in physical therapy and all this fancy schmancy corrective exercise. And now even personal trainers are learning how to do post rehab, blah, blah, blah. And again, what's going on? The solution to this orthopedic dilemma is to take an integrated and holistic approach, focusing on the whole person and treat the cause and not just the symptom. So what I began to learn working with this doctor in the chiropractic neurologist in North Carolina, remember he was a functional nutritionist, functional neurologist, and a chiropractor. We looked at nutrition and, and I will say that people out there are either ready to go to the cause or they're not. They don't want to get into the reason why behind it. I get it, right? So we worked on both. So in the clinic, we would suggest corrective exercise, which is active care. And that really helped because I had a different approach to how I would design exercises. I'll get into that later. I took a completely different approach rather than just pelvic tilts and ab bracing. And then, where necessary, he would suggest nutritional changes. And from my observation, what he basically did is when we did the consultation, he kind of offered his patients two ways of working with them. They can just come in, he'll treat it, you'll get better. Or let me really work with you, the neurology, the nutrition, and let's get to the cause. And that way, at least by being upfront and honest, that person can make a discerned decision. But could you imagine, and this is what's happened to me, I get a client and I start asking them about their sleep and their stress levels, their eating habits, the kind of exercises that they've done. And they're asking me, like, why are you asking me about my sleep? And why are you asking me a lot about nutrition? Nobody else did that. And when I explained to them, and what you're going to see in this presentation is when I showed them how it relates directly to their challenge, they were like, well, how come nobody else did that? Can you imagine if I didn't do that, you hired me, and I got you partially well. And then you go out, it comes back, you go to somebody else, and then they ask you all these other questions, and they teach you that these other areas need to be looked at. And you thought to yourself, wow, I wish I would have known about that back then. So I do the same thing. I get referred somebody in my private practice, and I have a discovery call with them. They get 30 minutes. Sometimes it's 45. And I ask a lot of questions about their health history and a little bit about lifestyle. And then I present to them, okay, this is how we can look at this. And after they've told me that they tried the other methods and it isn't working, I'll say, well, patching you up obviously isn't working too well. So you could patch it up a little bit better. So I can do a little bit of lifestyle and do a completely different approach on your corrective exercise strategy. Or you could enroll and learn more about correcting your lifestyle habits, which are directly related to musculoskeletal injuries. So as you look at this slide, you look at 1, 2, and 3. Now those are obvious and the other ones become obvious, but look at number 6. Now that has recently been added in discussion across the board. Now everyone is starting to recognize, physical therapists, athletic trainers, personal trainers, etc., they're really starting to look at unhealthy lifestyle factors in relationship to musculoskeletal injuries. But the results that I got, both in clinical and out clinical, was based on an integrated holistic approach. But I present people with an option. We're not presented with an option. And some people don't want the option. I get it. Just get me out of pain. All right, go down the street, go to the physical therapy, go to your medical doctor. If that's all you want, that they'll work with you on that. The people that come in and see me now, they've been referred. So somebody said something. 95% of the people that work with me are referred, and they say, I want to know more about why this is happening. I'm tired of this happening. And I present it to them in an integrated and holistic perspective. And then I say, now what we got to do is now we got to get information. So in this presentation, I narrowed it down to 4 stressors on the body. So integrated is combining or coordinating separate elements to provide a harmonious integrated whole. Now, it doesn't matter whether I'm looking at a back. You don't have a back problem, you have a body problem. So I'm also loosening up the muscles at your neck and down at your ankle. But I'm also connecting with your chiropractor. If you're seeing a body worker and a chiropractor, I got to connect with them. I got to integrate with them. I don't want to undo their work. And in order to do a better job, like I just emailed my client's chiropractor this morning because I want to make sure I'm on the right page with him, with what he's doing with my client. Holistic is treating the whole body in person, naturally, without the use of drugs. Okay. So this is what I was talking about, the integrated holistic team of practitioners. I created a team in North Carolina, and I had a bigger team in Milwaukee, cultivating a multidisciplinary team approach to client care, treating the root cause and not the symptom. This is how we all should be working. But it's not just I just send you to somebody. Here's the guy's business card, go see the chiropractor. No, well, big deal. Why don't we communicate? Why don't we talk technical? So when I contact the chiropractor, we can talk technical. So I did this morning. I asked him, is her, anterior superior iliac spine rotated to the right in a transverse plane, blah, blah, blah. She is presenting grinding and clenching, which is related to adrenal stress, which means her nervous system is ramped up. He needs to know this because he doesn't spend the time with his patient like I do. He only sees her for 20 minutes and does what he knows what to do, where I spend with some clients up to an hour and a half. And I got all kinds of data. When I come in to work with you, or you come in to work with me, the first 15, 20 minutes is a check-in because I haven't seen you for 7 days. How are you sleeping? How's your eating? Did you have anything off the reservation? Did you have any triggered emotions this week? I'm getting a barometer. I'm trying to get an idea where you're at so I know how to suggest the right exercise. It's no different than what a doctor does. A doctor checks your symptom and then he prescribes the right medication. But if he doesn't check that accurately, what can happen? You can have a side effect. Well, movement is medicine. So if I'm not checking in with my clients and I'm throwing exercise at them, and let's say like this other client, one I just mentioned, their nervous system is ramped up. They got too many things plugged into the light socket. They're blowing circuits. Well, I can't give her exercises that are going to ramp up her heart rate because that's just going to overload the system. But yet I have to still exercise with her. So I have created some mindful, Eastern approaches to movement that can both restore what their imbalances are without throwing them into fight to flight. What I'm talking about here is communication, not just referring to Joe Schmo, the body worker, the massage therapist. Now, I don't have to call my this client's chiropractor every week. It's not like that. But when in doubt, I email them out, or I get the phone out, or I refer out. And then there I always have to connect with these practitioners. Why are we not communicating? That's the number one reason why we fail in relationships in the world is because we don't know how to communicate. The right hand doesn't know what the left hand is doing. If when I was building out my facility in North Carolina, and I was in one facility and I'm working on the build out to expand into another part, and I wanted to get this thing done. I wanted to move in. I was excited. But I'm asking the drywaller, I said, well, why can't you finish that other room? He goes, well, the plumber hasn't been in yet. Well, I go, where's the plumber? He goes, I don't know. You know, of course, I didn't hire a person to manage this. So I had to call the plumber and say, where the hell are you? He goes, oh, I got stuck on a side job. Well, I go, you need to communicate with the drywaller and you need to give him a timeline. Maybe I can put him to work somewhere else. Or maybe I can call somebody else and so we can get this thing finished up because time is money for me too. Communication is what I'm saying here. Right hand has to know what the left hand is doing. I'm sure you all can understand that with how you operate in your families, in your businesses. So why wouldn't once in a while, if not more often, if you're working with the multiple practitioners, you're hiring us. So my client says, well, maybe I'll let the chiropractor know what you're looking for. I go, no, 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 that's not your job. That's my job. That's what you hired me for. I'll contact them. You can initiate, I had to sign authorization forms so that I can talk with them, HIPAA. So you can initiate that. You go in and you show them the form that, you signed with my business, and then you sign a form there, and then you allow them, you communicate with them. Yes, send Brian the x-rays, and Brian's going to contact Dr. So-and-so. Yeah, you do that for me. But after that, that's up to me. But if there's a snag in the roof, then I'm going to ask my client to contact them because she's the one paying the bill. All right. Does that make sense? Everybody on the same page here? Okay, now I'm going to stop after this, but these are the four major stressors that I see. Now, I can go down the rabbit hole pretty deep on each one of these, and I don't plan on doing that for this presentation. But I want to open your eyes. Again, you have back pain. What does emotional stress have to do with back pain? What does biochemical stress have to do with back pain? Nutritional, well, we know what physical stress has to do with it, right? If you got bad posture, you got tight muscles, and you're out of whack, is what they'll tell you. Like, I'm out of whack today. I got to go to the chiropractor. But if we're not sleeping right, how does that affect our structure and our system? If we're not only what we're digesting. Okay, so you have an injury, right? And those tissues have to be rebuilt. So when does your body rebuild? Most people don't understand that your body rebuilds at night. That's when you recover, restore, and replenish. Okay, so that's why sleep is important, especially between 10 p.m. and 2 a.m. That's when you do physical repair. 2 a.m. to 6 a.m. is psychological repair. But you also need raw materials. So if I'm building out and my drywaller shows up, but there's no drywall, well, I'm paying him to do nothing because there's no materials. Well, your body needs raw materials. You need water because your discs are water primarily. Your bones are porous, so they're water. Every system in your body runs off of water because water is electric. Electricity moves through it, and your body's electric. Your body needs protein. Your body needs minerals. But is it the right raw materials? Are you using cheap raw materials to build your structure? Right? So if you're building a house, do you want cheap raw materials holding that house up? No, because you might be investing $500,000 on building a house. So you want good damn raw materials. You don't want some wood that's been sitting out in the rain for 6 weeks and they're going to use that wood in your house. Number one, it's going to be moldy and it's already going to be deteriorating. That's just an example. What I'm driving home here is people understand Then when I ask them what they're eating, and they're like, well, what does that have to do with my back pain? Well, I said, number one, the food can cause inflammation. And if you got digestive issues, then it's really a challenge. But if you don't have the right raw materials, you're not going to build. When I work with athletes and they want to build muscle, I'm looking at their diet and they're like, they're eating at McDonald's. I'm like, well, that's tearing you down. And then physical stress, well, I got to, look at your posture and we got to correct what's imbalanced here. All right. So what do you think so far? Let me know in the comments what you think. And we're going to get into these in the next series because this will be presented probably in 4 series, maybe less. And my objective here is to educate. This isn't a sales pitch. It's about time. I have to do this all the time when I'm doing initial consultations or consultations. And I'm like, I just got to start teaching people. They need to know this. So no matter where they go, they are more knowledgeable because they're the ones that are sick and tired of being sick and tired. They're sick and tired of their back pain. You guys have a right to know this. So I'm empowering you with knowledge first. If you want to call me at the end of this, that's whatever. That's great. Maybe you don't even live in my geographical area, but I could still help you. But my point is the takeaway from this is knowledge is power, but applying it. All right. I hope you enjoyed today's first section on this. I look forward to presenting this in more detail. Have yourself a great day. Stay empowered and always remember Mark 5:36. Amen. Be well. Bye for now.